It's not painful and totally doable. Hi ladies, thanks for stopping by. My name is Hellynn and I started this channel just one video ago to talk about getting IVF in Korea and to talk about my infertility challenges such as being 40 and trying to have babies and DOR. Today I'll walk you through the process of IVF. Now that I've been through it a few times, I feel like I've got the gist. And so yeah, I'll walk you through it. So first things first, you need to get tested. There are 3 basic fertility tests that you need to get done before you start IVF or even get diagnosed with infertility before you start IVF. And number 1, you need to get your blood work done. So blood work is done so that you can test your AMH, FSH, prolactin, LH, TSH. There's a whole bunch of different things that you need to test for. There's also vitamin D deficiency, which is a huge reason for infertility as well. And DHEAS, which is something that a lot of people get tested for as well. So get all the blood work done so that you have a clearer picture of whether IVF is right for you. And number 2 is getting an HSG. This is supposed to be the most painful test out of all of the tests. Blood work, it's so easy and painless, but HSG is... I was really scared of this one, guys, but it's necessary because it's an x-ray of your uterus and your fallopian tubes, and they want to check if anything is blocked in there, what the shape of your uterus is. And so this is a very important test, but it's a little painful, so I do recommend taking some Tylenol 30 minutes before this procedure. Number 3, get a baseline ultrasound done to see how many follicles that you have before you start your stimulation shots, and also to see if you're ready to start stimulation. AMH is not the only indicator of how successful you're going to be, how many eggs you're going to get in each round. This is probably the clearest test that you can get done in order to find out how many follicles that you have. When you get all of these done and you and your doctor feel that IVF is the absolute best option for you, then you can move forward with the stim shots. And that would be on your 2nd or 3rd day of your menstrual cycle. I actually came to Korea to get IVF, and I had everything done, all the tests done in the States prior to coming to Korea, except for HSG, which delayed my entire stay in Korea by 1 month, because you can only get HSG done, I believe, like a week after your period or something like that, when your uterine lining is the thickest. So make sure that you time everything correctly if you are traveling abroad for IVF. You start stimulation shots usually the 2nd or 3rd day of your cycle. You are growing all of your eggs so that instead of having 1 egg per month, you can extract several and then try to have multiple embryos and select the highest grade embryo. Basically, you have an ultrasound first to check how many follicles that you have, and based on that, your doctor prescribes medication for you. I've heard in the States you have to order the shots from somewhere and it comes to your house, and I don't know, you have to wait for them, and it's like this huge big deal. But in Korea, or at least the clinic that I go to, they have their own pharmacy inside the building, after your doctor prescribes you the dosage for the shots. You go down to the pharmacy, pick them up, and then they give you your first shot and explain to you how you should be giving yourself shots. And you take them home and you stick them in your fridge and pick a time in the morning and you give yourself the shot every day. And that's about it. It's actually quite easy. If there is a downside to it, it's that the hormone shots make you a little bit more sensitive. So there is that, but all in all, it's not that bad. It's not painful and totally doable.
So I'm about to take my shot this morning. By now I should be like not afraid to do it, but every time I do it, I'm a little bit afraid just because of the concept of needles. It just freaks me out a little bit. Yesterday I did this part over here, so I'm gonna do this part over here. Grab the fleshiest side. Make sure you alcohol swab it. And then it comes pre-filled. I know that some shots don't come pre-filled, but I'm very lucky because I only get prescribed the ones that are pre-filled. So this little shot doesn't hurt that much, but it looks a little scary. I don't know if you can see that. This is what it looks like. And it goes in my belly. It helps to get as much fat on your stomach as possible, so eat a lot and become fat. And lean forward a little bit because then all your fat just kind of gathers and it hurts less. Scary, scary. 3, 2, 1. Okay, I got it. Okay, let go. Give myself the shot slowly. Oh, donezo. And then you press it for a few seconds. And that's it. It's always the part that where before the needle goes in, then I'm just like, ooh, but once it actually goes in, it's not so bad. It doesn't hurt at all. It's like a spider bite. We got this. We got this.
So as you can see in that video, I give myself a shot every morning and sometimes in the evening as well. It depends on what my doctor prescribes. And I go back to the hospital for a scan every 3 to 4 days, and they check my follicles, how well they're growing. And based on that scan, my doctor prescribes me a new dosage. So yeah, there's a constant scanning and adjusting of medication throughout this process. They don't just send you a bunch of shots and that's your protocol. The clinic that I'm going to in Korea, they continuously monitor and adjust the medication based on what they see during your scan. After about 10 to 12 days of stimming, when my follicles are about 1.5 centimeters to about 2 centimeters, my doctor prescribes me the trigger shot. And this trigger shot basically releases and matures the follicles so that they're ready for surgery. So you're supposed to take the trigger shot 36 hours before your surgery, exactly. They give you a time that you're supposed to take the shot. This is like a super important shot, so you can't miss it. You shouldn't miss any of your shots actually, but this one is really, really important. So on the day of your surgery, you change into your surgery gear. They ask you not to wear any kind of scented anything, so no lotion, no perfumes. Usually I even wash my hair with shampoo that doesn't have any scent. And I don't put any lotion on that has any kind of perfume in it. It's really bad for the eggs when they're extracted, so you just want to go in there as clean as possible. Don't put any hair products in, don't put any makeup on. You go upstairs and you lie down in a bed and they hook you up to an IV And you just kind of lay there in bed and wait with a bunch of other girls that are also laying down with curtains around the bed. At least you have a little bit of privacy. Our clinic has so many patients that the way that they operate is kind of like a factory. One surgery after another, and it's very efficient, but it's very impersonal. So there's that. When it's time for your turn, they guide you to the surgery room and you put your legs up on a harness and you lay down and the doctor greets you for a second and then you get put to sleep and you go to La La Land and you wake up an hour later and you're like, what happened? A nurse comes and tells you how many eggs you got, and they also tell you what to do, what not to do after the surgery, and when the next appointment is for you to come see your doctor so you can talk about the results. After egg retrieval, you definitely should stay in bed for a couple of days. I don't recommend that you go back to work. For me, my stomach hurts for the next 2 to 3 days, so I just make it a point to stay in bed. I deserve it. During your egg retrieval, your partner is in another waiting room downstairs with all these other men who are just sitting there waiting for their names to be called. After your egg retrieval surgery, a nurse comes downstairs and tells your partner to come in and provide the sperm. So yeah. Next, they send your egg and sperm to be fertilized in a lab, and they monitor the development. They don't usually call to update you about what happens. They send you a text message, and it's really impersonal, but they have so many patients at my clinic that it is what it is, and that's just the way that they do things. It's definitely a very, very nerve-wracking week, and it's the hardest week out of all the weeks of IVF, and so I usually have to distract myself a bit, but basically you're waiting for the best news ever or the worst news ever. So yeah, I've gotten the text message that none of my embryos developed, and I've also gotten the text message that 1 or 2 of my embryos have been frozen. So I understand the joy and the doom of both ends of the spectrum. So this usually happens a week after the retrieval, and you just gotta wait. I'm only doing IVF up to egg retrievals because I'm banking embryos. I am not doing any transfers at the moment because while I still have my own eggs left, I would like to bank as many embryos as possible. I have not had any transfers yet so far, and I know that's like a whole other process that I need to experience. But from what I understand, I will be doing an FET after resting 1 cycle to prep my body once I have enough embryos. They give you progesterone shots and progesterone suppositories, which sound really uncomfortable, and baby aspirin, and they prep your body and your uterine lining so that your embryo has a better chance of sticking. If I decide to do PGTA for my embryos, then the way that my clinic does it is they unfreeze the embryos that they want to test, and then this is all happening 24 hours before the transfer. They send it off to a lab, and they tell you 1 hour before your transfer whether the embryos are good or bad. So if all your embryos tested with abnormal cells, then your transfer is going to be canceled. So that's also another nerve-wracking day. I haven't experienced it yet, but I feel like that would be such a difficult day. A couple of weeks after the transfer, they give you a blood test, and They check to see that your HCG level, which is basically the pregnancy hormone, it needs to be doubling every couple of days. And that's the best indicator that your pregnancy is moving forward. So here's a quick update on my progress. If you haven't watched my first video, I'll link that up here somewhere. I finished my 3rd egg retrieval and it's so crazy. This time they really upped my dosage. They were like, let's just try it. You know, we've been doing mini IVF this whole time. So let's just try giving you a stronger dose and see how you respond. And fortunately, I responded better than most women with DOR. Usually a stronger dosage will fry your eggs, but I responded pretty well. And they were able to see 7 follicles at one point. And we retrieved 5 eggs. Now that might not sound like a lot, but since I have an AMH of 0.06, and usually they only see 1 or 2 follicles per month, I think 5 eggs is pretty good. We ended up with 2 blastocysts, and these are day 5 blastocysts. My doctor says that they're not the greatest quality, but they're also not the worst quality, so I guess average, just based on what they look like because they haven't been tested yet. Not great, but not bad either. But there was a time when I thought that I would get 0 embryos, so I'll take it. However, we will be moving forward with more egg retrievals because we want to aim for better quality embryos while I still have my own eggs left. And I did mention this before, but I do want 2 kids out of this, hopefully. That's it for updates, and I'll keep you guys posted. Do me a favor and like and subscribe to my channel so that this video can find its way to somebody that needs it. Thanks for watching. Bye.